Well, you've got a cold and it'll get well in 10 days. A lot of times people, or doctors at least, believe that people don't think, the patients don't think they're getting their money's worth. And the bottom line is you don't get your money's worth anymore walking out without the antibiotic. And doctors often, they'll feel compelled to give patients what they want. And we've dug ourselves a hole ourselves, because if the last 10 years, every time you had a cold, I gave you amoxicillin, why in the 11th time you're going to expect the same sort of treatment. So, yeah, question.
So I know bacteria get resistant to antibiotics. How about yeast getting resistant to antifungal oral medications?
Usually not. Not near the thing that bacterial resistance is.
Because it seems like, most doctors' first line of defense is, you go get the over-the-counter antifungal, but that's like 4 weeks of treatment. Whereas a lot of times it could just be cleared up for the 1 or 2 day prescription of an oral.
Right. Yeah.
So.
And often the cost is about the same. Yeah. So yeah. Yeast in general has not developed a resistant problem, but that's one of the reasons we don't want to give people antibiotics for things that don't help, because then when you do really get sick, when you get the pneumonia and you've got these bugs in your system that may not respond to the simple antibiotics, and you may have to do something more aggressive. The other thing related to that is what you watch on television before you go to bed and the advertisements you see there. And the things that get advertised there a whole lot are obviously not generic drugs. Nobody's out to sell generic drugs. But they're the newest kid on the block, a lot of antidepressants. And so what do you think the chance is that if you saw this new great antidepressant and you've been feeling down in the dumps, and you go to your doctor this afternoon and you said, I saw this information about this new antidepressant, what do you think the chance is your doctor will give you that? 90%. What? 90%. That's a little bit high, but they studied that a whole bunch of times, and it's like 60 or 70%. And why do they do that? Well, they want to please you. Sometimes it's an issue of time, that it's quicker to write you a prescription for the new drug than it is to explain to you what I'm going to tell you right now. That if you took all the antidepressants in the world, just to take those as an example, is there any one of them that's any better overall than any of the others? Absolutely not. Now, something may work better for me and this drug works for you and vice versa, but those drugs all have about the same effectiveness rate. So which would you rather take, a drug that came out 2 weeks ago or one that's been on the market for 20 years? What do you think? Why would you want to take the one that had been on the market for 20 years? 2 good reasons. Yes?
A good idea what the side effects are going to be?
Absolutely, yeah. Drugs can come to market now having been tested on 3,000 people. So what if every 4,000th person their left arm falls off? We don't know that when the drug hits the market. Yeah. And over again, and that's why drugs get taken off the market, because it's what happens after the drug is out being advertised on late night TV, and you and I go take that kind of medicine and we find out about the bad thing.
A year later on late night TV, you got these class action lawsuits.
Exactly right. Yeah, exactly right. Good point. Yeah. And the other thing is that in general, a generic drug may cost 10%, 15% of what the common brand name might cost. Yes?
How long from when drugs are trademarked until they go generic?
Usually it's about 7 years.
Okay, so
But all sorts of things have happened with lawyers. Lawyers get into this, and things get really dragged out a long time. Yeah.
Isn't generic the same thing as the other one? It's just one's name brand and one isn't?
Well, and that's true. Sometimes it's exactly the same drug. So for example, you can buy, well, this mixes things, but like Prilosec, buy it over the counter now. There's name brand Prilosec, or you can buy Walmart's omeprazole. Exactly the same thing. Yeah. Yeah, it's exactly the same thing. And one thing that's interesting is, and this always sort of blows patients' minds, is that sometimes the generic is made in the same factory on the same line that the brand name drug is. I mean, I've had people argue with me about why the generic doesn't work. You know, and it's made in the same building, on the same line with the same people. And so, but we're all really susceptible to what color is the pill, and red pills make me feel better, and you know, that kind of thing.
If they've got the exact same ingredients, then they're going to be the exact same. Just one's got to be
It should be. That's exactly right. Yeah, that's exactly right.
All generics exactly like their brand name counterpart?
To be approved by the FDA, it has to be a certified generic. It does. Now, you know, and why do generics get cheap? Because, you know, when a drug goes generic, usually there's 6 months where one company can make that. One generic company can make that brand name product. And during that 6 months, the price goes down, maybe 10, 15, or 20%. After that 6 months, anybody can get in the business. And then the price falls precipitously. It goes way, way down after 6 months. And that's what. They all have to follow the same rules that the brand name did to begin with. Yeah. So, yeah.
Can't they change how it's absorbed, like if they put it in a gel capsule or if it's time release?
They can,
that
but
type of stuff?
and they can do that, but if you do that as a generic, you have to do it just like the brand name did. Okay, yeah. How it gets dispensed into the system. Let's see. So so you get this prescription, the doctor hands you a prescription or says he's going to email it in, or however your doc does it. What's a reasonable question to ask? Okay, yeah, is it generic? And how much is this going to cost me, doc? Yeah. You know, and it sounds like I'm poo-pooing doctors, and I'm not, but physicians in general are not very savvy about what the things they prescribe or the tests they order cost. You know, and I can remember, would tell you with some embarrassment, you know, being called by the pharmacist, and the doc says, well, do you know what you just prescribed cost $250? And I had no clue. So it's a real reasonable thing. Most of us would not go to a fancy restaurant and order off the menu if there were no prices there. At least I wouldn't. I'm a cheapskate. I'd be scared to death I couldn't pay the bill. But we do that every day when we hand patients prescriptions or go over to the hospital and get an MRI of whatever body part, and we have no clue about what that costs. So what I'm saying to you is it's okay to ask that. And if the doctor doesn't know, the doctor ought to find out and be able to tell you what the test, what the prescription costs. And most of us carry around in our pocket a drug program that's available to all of you called Hippocrates. And you go to EPOCRATES.com, and you can look up things like what are the common side effects, what's this typically cost. So questions about that? I think these are really important issues. Okay, so let's move on to another concept, and that is this concept. Okay, that's the punchline. You better shop around. Okay, and I don't know if you all picked up, but you all get one of these that's got the box on it. Did you get one of those or not? Okay. Okay, so this was a survey. Who else needs one? Let's see. Share that one maybe. Sorry, Rick. Drive the cameraman crazy. So this was a survey that we did over the phone where we called, I think there are, 7 different pharmacies on there. And it was all done on one day. And we asked them what a cash-paying customer would pay for each of these 3 drugs. Okay? So, you know, you need to take all of this with a little bit of grain of salt because some of you at least have some health insurance that maybe helps pay for drugs. The point I'm going to make about that is look, for example, at, let's see, look at losartan, the first drug there, and look at the variation of the price at the 7 different drugstores. That blow your mind? Tenfold different, almost a tenfold difference in the price between a couple of the drugstores. If you look at atorvastatin, a medicine for your cholesterol, again, huge differences, the difference between $13 and $115 for the very same prescription. And so, you know, the point here is not that one drugstore is necessarily better than the other, but if you're prescribed something and you get to the drugstore and the cost is enormous, it's reasonable to say, I don't want to take that. I'm going to shop around. And as long as you don't accept it from the pharmacist, why, you're in good shape. Or if you have the prescription and the doc has told you that this is going to cost $150, it may be worthwhile getting on the phone and calling 2 or 3 pharmacies and see what kind of deal you can make. So, questions about that? You know, we spend a lot of money on drugs in our whole medical system, and I think you really want to be smart and be savvy about that.
Is there that much difference too in the compounding pharmacies?
You know, I think the compounding pharmacies are a whole different breed.
Because you don't really get a choice once they've compounded it, it's yours.
No, I think that's right. Yeah, and you know, and again, if I were going to get something compounded, when I call one of those pharmacies to do that, I always ask them what it's going to cost. You know, if I want 60 grams of this, what's that going to cost the patient, so I can tell them, because there you're sort of stuck. Yeah. Yes, ma'am. Oh, it just means that, you know, a lot of pharmacists today basically take pills out of a big bottle and put them in a little bottle. This means actually creating, a cream where you mix several things together, or you can actually mix other sort of ingredients and put them in a pill. So, you know, the retail pharmacies, like the ones listed on your sheet there, they are not in that business. But compounding pharmacies put together certain things. They do a lot of work with female hormones and testosterone and that kind of thing. So, okie doke. So let's see, we got about 4 minutes. I mentioned to you about Hippocrates. You know, I guess the final thing is that particularly if you've got more than 2 or 3 medicines, it's really a good idea to make yourself your own medication list. And then I would get that out and put that in your own physician's face or any specialist you go see to be sure that your doc knows exactly what you're taking. A lot of the biggest mistakes that physicians make are related to not keeping up to date. It's a nightmare to keep up to date with people's medications, and particularly when people go see multiple physicians, they go to the vitamin cottage, and so if you're taking things, keep your own list and then give your list to your doc and say, does your list agree with my list? I think that's really, really important. Things like drug interactions. You know, if you went to the cardiologist last week and he put you on a blood thinner, and now I'm seeing you for a urinary tract infection, and I don't know you're on a blood thinner, and I give you a sulfa drug, and 3 days later you're bleeding all over the place because of the drug interaction thing. Yes?
You covered it talking about the medications, but what about procedures? Because I've heard there's a big difference between St. Mary's and community hospital on, say, MRIs or something.
Yeah.
How do I find out? Because if I call St. Mary's and get the front desk, I don't know that anybody will tell me.
And they won't. You're exactly right. And I'm not pitching community in any sense, but community is much more transparent about what things cost. I can find out, you can find out, anybody in this room can find out what anything costs at community hospital.
Calling the front desk or?
Well, and yeah, you call, like you say, I want to talk to the lab, or I want to talk to the x-ray department. I call the department that's going to have the information. Sometimes you can get things less expensively done actually in a doctor's office. The cheapest CAT scan of the chest in town right now is not at either hospital, but it's in the pulmonologist office, Dr. Bechtel and Kelly and that group. Sometimes the cheapest MRI in town is not in either of the hospitals, but in one of the orthopedic offices.
Rocky Mountain has their own MRI machine.
Right, yeah.
Why is it so different? For example, MRIs. And I tried to do this. I tried to get a prescription to go to Denver to get an MRI, which was like about $250, and either at community or St. Mary's, it's in the thousands.
Mm-hmm.
Why won't the doctor let you choose where you're going?
Oh, I think ordinarily, I mean, if you did that amount of research and we knew it was a reputable place, no, I think that's fine. And I think you shop around about drugs, you shop around particularly about expensive tests.
Because it was cheaper to go to Denver, spend the night, get the test, and come back.
Right.
But they wouldn't accept the results.
Well, and I would just tell you, and this sounds like sour grapes, but sometimes, like if you're going to get your neck operated on or your head operated on, the neurosurgeons are sort of persnickety about wanting to be able. Huh? What did you say? I'm sorry. Oh, okay. They're persnickety because they want to be sure they get exactly what they want. But in general, no. I think, you know, I mean, the ultimate sort of thing is you can go to get cardiac surgery in places in Europe for 1/10 of what you can here. And it's about money. And medical economics don't fit with any other kind of economics because the more orthopedic surgeons you have in a community, the more the costs go up. They don't go down. Competition sort of phenomena does not work, unfortunately. So that's not a very good note to end on. Anybody else have any other questions? So, yes, ma'am.
Is there a specific type of data file we should ask for if we do go elsewhere to get MRIs or X-rays or anything like that? If they're going to put it on a CD?
Yeah, I don't think so. I mean, the things that come back from Denver or Salt Lake City always, the radiologists here always seem happy with it. So I don't think that's a big. Yeah, I think not. Yeah. Yes, ma'am.
But we're all through Hilltop, and we have to go to PCP for all of our medical, or they charge us more. So you got to think about that too. You go to a different doctor or whatever, because we have to work with them.
Yeah, and you know, and I work for that company, and so it's you know sort of an uncomfortable situation. On the other hand, if you called up community hospital and could get the same test done for less out of your pocket, then do that. Yeah, I mean there is nothing magic about where you get the test done, and part of the problem is things do get into silos, and Hilltop and Primary Care Partners have negotiated about this. I don't know any of the details about the negotiation, so anything I would say would be off. But I would say to you as a person, if you can get your TSH or your lab test done someplace cheaper in this community, then do it. I mean, the quality issues are the same, and you know, I know that the people in our laboratory try to stay competitive, but I can't tell you that you might not find something less expensive, and there's no reason not to do that. Absolutely. Well, it's a little after 1. If anybody wants to stay, but thank you. You're a good audience and good questions. Thanks.